in the US, we're changing stuff because people are saying that that's too long and they can't isolate for 14 days. What is the response that contact tracers, or the approach that contact tracers should take when you have people that just won't do, outside of, like, yeah, you care about your community? What would be your response?
Actually, that's an excellent question. So let me walk through the thinking on that so that you can. So, first, let me just say that the quick answer for what you all should be doing is you all are going to be meeting regularly. The contact tracers are going to be trained. And hopefully, in the city of Chicago, at least, all the contact tracers are going to be having a standard recommendation as a general notion. But the key thing is this: you have to understand what that means. So when this first started, we didn't really understand what was going on, or how fast people got infected. So we picked a date from the data from China. We picked a date, and 14 days, by 14 days, 90%, not exactly 90%, a big percentage, 86, 89, 93% of people were no longer shedding virus and infecting other people. That's what you want when you have them in quarantine. Or I'm sorry, they did not. If they were going to get sick, they would have gotten sick by 14 days. 90%. So if they get infected, some people can get symptoms in 2 or 3 days. Some people, most typically, it's 5 days. By the time you get to 14 days, if you haven't been sick, then the chances are you're not going to be sick. It's not 100% though. So remember this, okay? So there's a spectrum. And if you do go through the contact tracing, you'll learn the spectrum. So we start off in the beginning. We don't have any medication. We don't know exactly what's going on. So we give a guesstimate, 14 days, which I think is still a reasonable day. Now, here's the problem. If I tell you you have to be off of work for 14 days and you're losing 14 days of pay, you might get evicted, right? You might not be able to pay your car note. Whatever horrible things happen if you don't have money, and so and unfortunately we don't support people. Okay, we don't. It's not like we say you have to be quarantined and we're going to make sure we pay all your bills and bring food to your house and feed you and your kids. So that's a problem. Here's another specific problem that you may appreciate in the hospital setting. So, for example, at Stroger Hospital, every time someone think about this in a hospital setting, every time someone is in close contact, okay, because that's what, and we're not sure, we want to quarantine you to be safe, that just eliminates more and more of your nurses, doctors, janitors, dietary people. And so that's the place where this 14-day got changed earliest. So I know at many of the hospitals in Chicago, what they would do is test people. And at 10 days, they would say, well, if you've had 2 tests, negative tests, and it's 10 days, we're going to let you come back to work because we got people in the hospital that are sick and dying and we need your help. So even something as simple as 14 days is done with other considerations involved. So that's why sometimes you may recommend 14 days and sometimes you may recommend 10 days. So hopefully that sort of that logic makes sense. So the key thing for you is there's not one answer. It depends on where we are in the pandemic. It depends on how good our tests are. Our tests have gotten better. It depends on a lot of things. Another example, which CDC has changed, which is good, which we knew was wrong when they said it. It's not that it was wrong. It's not that it was bad advice, but it's just that we didn't explain why we say it. So 6 feet. So I'm going to tell you right now, as an occupation, 6 feet, 7 feet is not safe. 6.5 feet is not safe. 6 feet, again, a certain percentage of droplets will hit the ground before 6 feet. So that's the standard recommendation. When we found out it stayed in the air longer, then 6 feet probably wasn't far enough away. So one of the tasks is for you to understand why they said 14 feet or 6 feet or 3, whatever they say. Why? What's the logic behind it? Then if you understand the logic, then if conditions change for whatever reason, then you can understand why the recommendations may have to change. So fortunately, you don't have to change the recommendations, but understanding why becomes important.